Glycemic index and diabetes blood sugar management. Glycemic index, GI, is a measure of how quickly a food raises blood sugar levels and plays a critical role in diabetes management. Effective blood sugar control is essential to prevent complications and improve outcomes in patients with diabetes. Overview. Glycemic index, GI, refers to the rate at which a food raises blood sugar levels after consumption. Foods with a high GI cause rapid increases in blood glucose, while those with a low GI lead to slower, more gradual increases. In the context of diabetes, managing GI is crucial for maintaining stable blood sugar levels and preventing hyperglycemia. Patients with diabetes are often advised to follow a diet with a low GI to improve glycemic control and reduce the risk of long-term complications such as cardiovascular disease and neuropathy. Pathophysiology/mechanism of action. Diabetes is a chronic metabolic disorder characterized by impaired insulin secretion or function, leading to hyperglycemia. The glycemic index contributes to blood sugar fluctuations by influencing the rate at which carbohydrates are absorbed and metabolized. High GI foods can cause rapid spikes in blood glucose, which may lead to insulin resistance and further exacerbate the condition. Insulin plays a key role in regulating blood sugar levels, and its effectiveness is influenced by the GI of the foods consumed. A low GI diet helps to maintain a more consistent blood sugar profile, reducing the burden on the pancreas and improving insulin sensitivity. Clinical features/indications. Patients with diabetes often present with symptoms such as polyuria, polydipsia, and fatigue. However, many individuals with diabetes are asymptomatic. The primary indications for managing glycemic index include the prevention of hyperglycemia, reduction of cardiovascular risk, and improvement of long-term outcomes. In clinical practice, the GI of foods is often used to guide dietary choices, particularly in patients with type 1 and type 2 diabetes. A low GI diet is recommended to help manage blood sugar levels and reduce the risk of complications. Diagnosis/monitoring. Diagnosis of diabetes is typically based on clinical symptoms, fasting blood glucose levels, and HbA1c levels. For patients with diabetes, monitoring blood glucose levels is essential to assess the effectiveness of treatment and dietary interventions. The glycemic index can be used as a tool to guide dietary choices, and blood glucose monitoring should be performed regularly to ensure that blood sugar levels remain within target ranges. Continuous glucose monitoring, CGM, can also be used to provide real-time data on blood sugar fluctuations and help patients make informed dietary decisions. Treatment/management. Management of diabetes involves a combination of lifestyle modifications, medication, and dietary interventions. A low GI diet is an important component of diabetes management, as it helps to regulate blood sugar levels and reduce the risk of hyperglycemia. Patients are encouraged to consume complex carbohydrates, fiber-rich foods, and foods with a low GI. In addition to dietary changes, medications such as metformin, sulfonylureas, and DPP-4 inhibitors may be prescribed to help control blood sugar levels. Regular monitoring of blood glucose levels and HbA1c is essential to adjust treatment plans as needed. Key clinical points. 1. A low GI diet is essential for managing diabetes and improving glycemic control. 2. Blood glucose monitoring and HbA1c levels should be regularly assessed to guide treatment decisions. 3. Continuous glucose monitoring can provide valuable insights into blood sugar fluctuations and help patients make informed dietary choices. 4. Lifestyle modifications, including physical activity and weight management, are also critical components of diabetes management. 5. Patients with diabetes should be educated on the importance of glycemic index in dietary choices and the impact of food on blood sugar levels. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.